Good morning and welcome to the webinar. My name is Kyle Wolf and I'm a broker advisor at Cornerstone. I'm joined today by representatives from Humana for the first webinar in our fourth quarter update series. They're going to talk about Go 365, new business and quoting requirements, new level funded plans, and more. But first, we have a little bit of housekeeping. If you have any questions throughout the presentation, please type them in the question box and we will address them during the Q&A at the end. My information is on the screen if you'd like to get in contact with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you're currently not subscribed. The new and improved AGB broker portal has launched for all of our broker partners as your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commission schedules. If you have any questions about the new platform or your access, please reach out to your broker advisor or the AGB support team at agbsupport@crnstone.com. Now, without further ado, I'm going to toss it over to Humana. Take it away, Becky.
Hey, Kyle, thank you. I am going to share my screen. Do you see it up there, Kyle? Is it up visible? Great. I'm Becky McDonald. I'm an agency relationship manager at Humana, and I'm here today with Tyson Brown, who is our inside sales representative, and Megan Ream, who is our consumer experience professional. We have an agenda today, and what we're going to do is talk a little bit about our Humana team. We're going to go through some new business reminders. We're going to touch on Go 365 updates that are going to carry you into the fourth quarter. And then we're going to go over some new LFP product updates along with our timelines. And then I think we're going to leave time at the end for any questions. This screen is our Humana team, and this is the team that works closely with Cornerstone. Many of these faces may look familiar to you. I actually just celebrated my 20-year anniversary at Humana, so I've met a lot of people throughout the industry, and I greatly appreciate the relationship that we have, the long-term relationship that we've had with Cornerstone. So these are the faces of the Humana team. One thing that's changed is that we do have a dedicated team to work on ancillary and specialty. So Cornerstone has dedicated resources to dig into all the specifics on all your ancillary needs and to get you competitive rates and to help match up plans. So just wanted to introduce the team. And now I'm going to hand the torch over to Tyson Brown. And what we're going to do is just talk a little bit about some new business requirements just to get you into the fourth quarter and get you ready for the busy season.
Good morning. Thanks, Becky. I'll just touch on a couple of these pieces. I know this is a lot like our cover sheet for new business requests. And I just want to tell you a little bit about what's on here and what usually gets hung up, especially during fourth quarter when our turn times are a little longer. I would say the biggest piece on this is we all oftentimes have requotes where we'll change the group's SIC code. If we don't include the nature of business, we do try and look it up in Dun & Bradstreet in our internal system. Sometimes we don't find the exact business, and SIC codes can cause rate changes because we do file different rate factors based on the risk that an SIC code has. Other than that, payroll, eligible, and enrolled are important to us, basically because of how our business segments and underwriting works. So if there are over 100 eligible, it ends up in large group, which Leslie Eisler handles. And then if it is over, 51 payroll, then it would go to our small group underwriting team. So they can be, 120 on payroll, but only 30 eligible, and they'll get a fully insured underwritten quote. It's a fairly important distinction just because if we release a community rated quote and we find out that they actually have over 50 on payroll during installation, it will cause us to stop because they're not eligible for that business or that installation piece. Additionally, I know not all carriers are requiring the most recent renewal. If the group's shopping off renewal, we will take the last year's renewal. I know it can hold us up, especially in fourth quarter if renewals are delayed, but our underwriters do feel like it's a fairly good indication of risk. And then the last thing I want to talk about is, actually we'll go with two things. The first being the dependent level census. We do need dependents on there if we're not getting applications, because we do run it through a third-party vendor to get a risk analysis. And then the multi-location piece of that, if we don't have work zip codes, we're going to make assumptions. And if those assumptions change, we do file our rates by county. And if we do end up putting people in different counties based on finding out about multi-location later down the line, it can change the rates again. So just some warnings on general rating and what we need to quote. Becky, any comments or any? Becky, are you on mute?
On mute. Yeah, I'm sorry.
Okay.
Yeah, no, just as far as fourth quarter, sending in complete information all at one time is important. We get very busy, and obviously the turnaround times are a little bit slower. So having complete information at the initial submission, which Cornerstone is great about doing, is something that will help turn around the times faster and get you what you need from our perspective. So that would be the only thing. And Tyson, as far as turnaround times, last year at fourth quarter, how long about did it take to get a quote in the busy season?
I'd say last year our longest was probably 6 or 7 business days. We've had years where we've been 2 weeks out. Hopefully we're in the same ballpark we were last year, which is about 5 to 7 business days at our busiest.
Okay. Just to give everybody an idea, and hopefully we always hope for quicker turnaround times, but just to kind of give a gauge of what we were looking at from last year's perspective.
And I would say that peaks around the week before Thanksgiving is probably our most weighted time period for quoting.
Okay, perfect. Well, if you guys have any questions about that, please put it in the chat and we'll address them at the end of the presentation. And with that, I'm going to hand over the Go365 updates to Megan Reams, just to hit on a couple of things.
Yes, thank you. Good morning. Yeah, I just have a few Go365 updates for you guys. Nothing crazy. One of them being on our compatible fitness device list, Amazon Halo was recently added as one of our new compatible devices. So this will track steps with Go365. So just like any other step tracker that's compatible, once it's connected to the program, you'll earn a point for every 1,000 steps you take with that device. It's obviously available at Amazon, but we also have it in our Go365 mall now. So if you wanted to spend your bucks on that device, you are able to do that as well. The second update, we have our 5th annual National Step Challenge coming up. This is our favorite challenge in Humana. We always have those step challenges monthly that you can join for points, but this one, we actually partner with Feeding America. And this challenge is all of our employer groups that have Go365. You are all automatically broken down into teams by company. So all you have to do to join this challenge is go into your challenge platform on the app or the website and join the National Step Challenge, and it will automatically put you into your company's team. So that's all you have to do to join. You'll see here the enrollment period for this year is Monday, August 29th, so this coming Monday through September 27th. And then the actual challenge will run from October 5th to November 2nd. You will earn the 100 points for a challenge just for participating, just as you would any other step challenge within Go365. The whole challenge itself is broken down into divisions based on group size, and the winners of each division will also have meals donated to Feeding America under their company's name. So that's kind of cool as well. So we're going towards a good cause as well as giving you another opportunity for those challenge points. So more to come on that this week. You'll probably be getting a lot more communication around the program itself, how to enroll, questions that you might have, FAQs. So more to come on that in the next week. Then the last thing, just so you guys remember, you do get bonus points for taking your online health assessment within the first 90 days of your program year. For you guys, by the end of September, if you go in and take your assessment, you will get a bonus 250 points. So you still have time to go in and answer those questions about your health. I did pull your report and notice that a lot of you have already taken it, which is great. But this is just a good time to remind you that if you wanted those bonus points, go in and take that assessment when you get a chance before the end of September. And then one more thing, just so you guys know the difference between your contacts and resources for Go365, you do have access to an Inside Engagement Professional, or IEP, and this is going to be the contact for all things Go365 and wellness for our small business clients, so 2 to 99 groups. And this person will be your go-to for if you needed pre-recorded brainstorm presentations, if you needed Zoom meetings. They will send out monthly newsletters, Go365 updates. They're available to any kind of education or engagement resources you might need. They're able to assist you with that. So they'll communicate with you with those updates as needed and just assist you in any way that they can with Go365. They will also work with you on an agency basis. So they will work with you and your block of business, same idea, give you all the resources that you need to help promote the program, education, and help with engagement and participation in Go365. So they're available to help. You do have a designated IEP. Her name is Araceli Castillo, so she is our Ohio IEP. So you'll see on the right side here, if you send an email to that sbengagement@humana.com, anything that you guys have will be filtered directly to Araceli, and she will reach back out to you. So you do have that one-on-one. She's very good. She'll be able to help you with anything you might need around wellness and Go365. And then you also have a CEP, Consumer Engagement Professional, which is what my role is, and that is for same idea, but for large groups. So any groups that are 100 plus, I would be the resource for Go365 and wellness. Both teams do work very closely together. We're always talking, communicating, collaborating. So we will always be working together and making sure all of our groups have what you need.
And I would just add that Araceli speaks Spanish. So if you have a need for that, that's been very beneficial when setting up those virtual meetings and helping with translation. So just to make a note. I'm going to dive into the portfolio changes. Community rated is still being approved by the Department of Insurance. So unfortunately, we don't have updates, but that will be coming, and we're targeted for a 10/1, quote, 1/1 effective date. But the focus today is going to be on the level funded premium, which is a 9/1 quote for a 10/1 effective date. And this is going to be for all markets. The idea is that we wanted to offer a portfolio that was affordable and competitive. So that is our hope. To dive into some of the differences, we're going to have 4 plan options. We'll have the savings HSA, the simplicity, the copay, and the on-hand plans this year, and that is going forward. If you're on old LFP plans, you can renew on those. If you were to make any plan changes, then you would have to go to the new medical portfolio. A couple differences is that there are going to be specialist copays at a 2 times PCP copay. The urgent care is going to equal the specialist copay on many of these plans. You're going to see a copay plus deductible coinsurance option for ER and outpatient surgery. We're going to be switching the therapy visits to a 20 visit limit for each therapy. In the past, it was 40 combined, so now they're going to break them out to 20 to each, which actually ends up being more therapy visits. We're also going to have RX5 pharmacy options. We're going to have HSA plans with copay options. And as I mentioned earlier, we are no longer offering the canopy or efficiency plans. I'm going to take some time to briefly walk through each of the 4 plan designs. Cornerstone is going to have a side-by-side comparison and information out on their portal in channels, and we'll get this information to you. So you don't have to scribble down a bunch of notes today. You're going to have this available to you. But on the simplicity, you'll see here, we have the 2019 generation in the first column and the 2022 generation in the second. I'm going to focus on that second column. So a benefit with the PCP copay is now people under the age of 19 don't have to pay a copay for your primary care doctor. As I mentioned, the specialist copay is 2 times the PCP, and I think this helps streamline and make things a little bit easier to remember the specialist copay. Your urgent care physician copay is going to be a specialist copay. And then, as I mentioned, we had those therapy limits at 20 visit limits for each covered therapy service. And this is a benefit that I greatly appreciate, and I think it's very important on behavioral health with Doctor on Demand, which is our virtual carrier. We are offering those virtual visits for behavioral health at a $0, no additional cost. I think with all the things that happened with COVID and the need for increased behavioral health services, that's a great benefit. And then to just hit on hand, you're going to see some of the same consistencies that you saw on the other plan, and you'll see this throughout. The copay, 0 for 0 to 19. The retail clinic, depending on the plan that you choose, it can be deductible then coinsurance, or it can be a $20 retail clinic copay. Same benefit with the therapies, 20 for each. And at the very bottom, I want to point out that on-hand plans now have embedded in all of the plans Go 365 and those wellness incentives that you get, along with all of the clinical programs, as we do with all of our small groups. Savings at HSA. You might notice that the name's a little different because we've now named it Savings HSA. We're going to embedded options only. The reason for that is that's really what we sell. So you'll see again on the 2022 generation, the name Savings HSA. Urgent care physicians are going to be dependent upon the plan that you choose. So they can either be deductible then coinsurance, or deductible then specialist copay then coinsurance. Therapy, as we are consistent with the visit limits on all our plans. And then the behavioral health, because it is an HSA, there's going to be deductible, then no additional cost. And then I'm going to talk a little bit in more detail about the pharmacy options in a slide, but we are going to have a preventive RX3 option built into the HSA pharmacy benefit. And then lastly, we have the copay option. This is probably our most common plan that we quote along with the HSA. Some of the big differences on this plan is for the emergency room, you'll see depending on the plan, there's going to be an ER copay, then coinsurance, or an ER copay, then deductible, then coinsurance. And this is consistent down to the ER physician services. Depending on the plan, it could be coinsurance or deductible, then coinsurance. Therapy visits are consistent with what we've talked about. The behavioral health visits are a $0 copay. And then the pharmacy, we're moving from an RX4 option to an RX5 option. So you'll see an RX5 blended, which offers tier 1 and 2 copay options and tier 3 through 5 deductible then coinsurance. Or you'll see an RX5, which offers tier 1 through 3 copays and tier 4 and 5 coinsurance. And again, there's going to be various plan options within these different types of plans. And as I mentioned earlier, just to touch on the pharmacy a little bit further, for the level funded plans, there are RX5 options, and these are what you're familiar with, the blend of copay and coinsurance across all tiers. You're also going to have an RX5 blended option, which offers $5 copays for tier 1 and 2, and then coinsurance for tiers 3 through 5. And on the high deductible, it'll work the same as you've seen it in the past, deductible coinsurance, but there's also going to be an enhanced offer with a 3-tier copay structure for certain maintenance medications, specific maintenance medications that are included on the IRS enhanced preventative list. So you're going to see that on the quotes as well. So I hope everybody is ready for fourth quarter. I am not, but I'm going to have to be there. New business quoting opens up for 1/1 starting October 12th. So start to gather your information, work with Cornerstone to get yourself prepared. And then the 1/1 renewals are going to be released the week of October 20th. Also, this does not impact a lot of people on the call since the quoting is handled through Cornerstone, but there are no phone lines for Easy Rate and Conservation effective September the 6th. So just wanted to make everybody aware of that. So that would conclude the presentation. Kyle, I don't know if you have any questions in the chat that we can address.
Let's see one here. On the ER benefit, are copay and deductible the only option, or will there still be a copay only available on the ER?
It's going to be those two options that we outlined, deductible coinsurance or deductible copay coinsurance. So the old plans just had the copay. And what we'll do is, again, we have a one-pager, and we also have the plan designs that we will send to you. But the nice part is that we have a lot of plan options so that you can choose. And the idea is there are richer benefits where the group may want to pay a little bit more, but then we have leaner benefits where there's more member cost share, and that will help with the pricing. So it just depends on the strategy that you would take with the group. But once you see the plan designs, we have those outlined by state, so Indiana, Ohio, and Kentucky, as we have in the past. You'll be able to see all of the options, and they work the same way that they have in the past, in that they are like you don't do select drop downs. They're all one option with a number, so that won't change.
Gotcha. Next question is, where are these plans offered? Are they offered in Michigan?
We have plans offered in Michigan. Specifically, I have loaded in Indiana, Ohio, and Kentucky, but we can certainly pull Michigan information and work with Cornerstone and whomever asked the question to talk to them individually about what's available in that area.
This is Tyson. We do have some medical there. A lot of it is legacy HMO plans from our standpoint. We do occasionally sell some medical there, but I wouldn't say it's one of our stronger markets, just so you're aware. And that's mostly in southeastern and then southwestern Michigan.
Gotcha. Thank you, Tyson. Next question is, on the level funded plans, will there be options in the renewal packet, or will we have to request those alternates separately?
I do not have Casey on the phone, so that is one that he would be able to answer right off the top of his head, but I will follow up with Kyle and get that answer to you. I just want to make sure that I'm getting you the correct information. So we will get back to you on that question.
I do believe that there is a program to generate automatic alts for a lot of groups as they come up for renewal. I've seen updates sent internally to the whole inside sales and retention team that they're being worked on every month. I'm not sure if that's for every group or a certain subset, but I do know that we do have that somewhat automated already.
So we'll just get some clarification, and we will let you know on that question.
Next question, can you provide more detail about the IRS enhanced preventative drug benefit with the HSA plans?
We do not have that list available just yet, but there are certain conditions that have been approved by the IRS, chronic conditions. So in the past, they weren't always considered preventative, but that list will be available. And so that is going to be built into our HSA plans, where it will be covered at a copay level, like a 3-tier copay level, in addition to how the rest of the medications worked on a qualified HSA plan. I think once we get that list, we will have that available to Cornerstone, and they will load that so you can see what those medications are.
Okay, perfect. That looks like that's all the questions that we have for today. So if you have any additional questions, please email me or give me a call. And thank you very much to Humana for joining us today. And everyone have a great, wonderful rest of the day.
Thank you.